Hello everybody, welcome to Voices of Friedreich's Ataxia. Our goal is to raise awareness and funds to cure Friedreich's Ataxia, FA. Today we will talk about erythropoietin in FA. Frataxin production may be stimulated through the use of erythropoietin, a naturally occurring protein. In 2010, an Austrian research team reported results of a small proof-of-concept trial in which 12 people with FA received erythropoietin injections 3 times a week for 8 weeks. 8 of the 10 trial participants showed stable increases of frataxin levels, with individual increases ranging from 15 to 63%. Ataxia severity showed a 6% improvement in study participants. Carbamylated erythropoietin, a derivative of erythropoietin, has been shown to increase frataxin levels in FA-affected cells without the unwanted added effect of stimulating blood cell production, as erythropoietin does, making it a potential alternative for drug development for FA. This information was taken from MDA with their permission. Their link is provided in description. Hello everybody, welcome to Voices of Friedreich's Ataxia. Our goal is to raise awareness and funds to cure Friedreich's Ataxia, FA. Today we will talk about iron chelation in FA. Iron chelation, the trapping of harmful, unbound iron, is a possible therapy for FA. A 2008 study in research mice that didn't produce frataxin in their hearts showed that iron chelation significantly decreased iron levels in the heart and limited the harmful increase in the size of the cardiac muscle normally seen in frataxin-deficient mice. An ongoing study to evaluate the effects of an iron chelator called deferiprone in people with FA in Europe may increase understanding of whether iron chelation should be part of an FA therapy regimen. There is some evidence that combining an antioxidant with an iron chelator may be beneficial. A 20-person study for which results were announced in 2010 found that a combination of idebenone and deferiprone had a stabilizing effect on neurological function and reduced abnormal heart muscle enlargement in people with FA who received the two-drug combination for 11 months. This information was taken from MDA with their permission. Their link is provided in description. Hello everybody, welcome to Voices of Friedreich's Ataxia. Our goal is to raise awareness and funds to cure Friedreich's Ataxia, FA. Today we will talk about protein therapy in FA. Another approach to treating FA involves inserting new frataxin protein molecules. Recent research has shown that the frataxin protein can be modified so that it can cross membranes and get to the right place in cells, the mitochondria. This information was taken from MDA with their permission. Their link is provided in description. Hello everybody, welcome to Voices of Friedreich's Ataxia. Our goal is to raise awareness and funds to cure Friedreich's Ataxia, FA. Today we will talk about HDAC inhibition in FA. The biotechnology company Repligen has received MDA support for development of an experimental treatment for FA known as histone deacetylase, HDAC, inhibition. HDAC inhibitors keep readme signals called acetyl groups on genes. Cells interpret these signals to mean that a gene is available to be read and used for protein production. HDAC inhibitors may make it possible to stimulate frataxin production despite the presence of a mutation in the gene. This information was taken from MDA with their permission. Their link is provided in description. Hello everybody, welcome to Voices of Friedreich's Ataxia. Our goal is to raise awareness and funds to cure Friedreich's Ataxia, FA. Today we will talk about gene therapy in FA. One approach to treating FA would be to supply functional frataxin genes or protein molecules to the person with FA through the insertion of functional genes to compensate for non-functional ones. Various gene therapy-based strategies hold the potential to benefit individuals with FA. Although it's relatively early in the game, a limited number of studies in mice and human cells have yielded some encouraging results. In a 2005 study, researchers used lentiviral or adeno-associated viral (AAV) vectors to carry the human frataxin gene into fibroblasts, cells that mature into a variety of connective tissue types, from FA patients. A vector is a delivery vehicle for therapeutic genes. Results included increased frataxin protein levels and a reduction in the treated cell's sensitivity to oxidative stress. A 2007 study analyzed the feasibility of gene insertion via the emptied-out shell of the herpes simplex virus type 1, HSV1, partnered with a stretch of DNA called an AMPL icon that helps the vector target a specific cell type. Results in FA-affected mice and human cells showed highly efficient DNA transfer and increased levels of frataxin production. Similar positive results in 2007 came from a Spanish study in which mice were engineered so that researchers could eliminate, or knock out, frataxin activity specifically in motor neurons. The mice developed neurological symptoms after 4 weeks, but achieved full recovery in as few as 4 weeks after receiving injections of HSV1 AMPL icon vectors carrying DNA that codes for human frataxin. A Spanish study published in 2010 describes the successful use of artificial chromosomes and similar constructs called apisomes to act as vectors for transporting genes to their targets. This information was taken from MDA with their permission. Their link is provided in description. Hello everybody, welcome to Voices of Friedreich's Ataxia. Our goal is to raise awareness and funds to cure Friedreich's Ataxia, FA. Today we will talk about medical management in FA. Treatments for Friedreich's Ataxia, FA, generally target specific symptoms rather than the disease itself. Fortunately, FA's most life-threatening symptom, heart disease, can be controlled with treatments developed for use in heart conditions not related to FA. For example, certain drugs, ACE inhibitors, diuretics, and beta blockers, can decrease the workload of the heart, and pacemakers or medications can stabilize an arrhythmic heartbeat. Likewise, diabetes can be managed with insulin. Surgical procedures can correct foot deformities and scoliosis. One type of scoliosis surgery is spinal fusion, which involves straightening the spine and then placing small pieces of bone over it, which grow together with the spinal bones and fuse them in place. Although there's no way to stop the progression of ataxia or muscle weakness in FA at this time, therapy can make it easier to cope with these problems. Physical therapy can help stretch tight muscles and enhance flexibility, and speech therapy can help retrain tongue and facial muscles to improve speech and swallowing. Your MDA clinic can provide you with referrals to these specialists. The discovery of frataxin and its roles in iron regulation and oxidative stress have raised the possibility of treatments that might attack the underlying disease process in FA. Antioxidants, such as coenzyme Q10 and idebenone, have been tested in FA and have not shown significant benefits. However, some experts recommend them, on the theory that the trials may not have been long enough or sensitive enough to show benefits. Newer drugs that target the genetic defect in FA are in development. This information was taken from MDA with their permission. Their link is provided in description.